this is Dr. Tony Alda here talking about your home blocking setup. Today's position will be showing something called posterior T12. Posterior T12 is when your thoracic spine and your mid-back kind of falls backwards and moves backwards, your head tends to move forward. It's a very common subluxation pattern that occurs. So we have a blocking setup to help counteract that. For this blocking setup, you're going to be using your appropriate cervical roll, and then you're going to be using both spinal wedges kind of set up just like this, kind of both together with this thin part facing down towards your feet. They're going to be positioned right in the transition area of your low back to your mid back, so kind of like that. And then of course the cervical roll will be under your neck. And the way you do this is you kind of get your appropriate size that once you have this figured out, about how far apart you would be. And the simple thing is you just go ahead and lay right down on top of them, just like that. And you can kind of see here, for her this is a little high, so go ahead and stand up. And then you want to make this a little bit lower, get positioned correctly. There you go. You kind of see it's kind of positioned a little lower, so you can kind of see this is her lumbar spine. We're transitioning into her mid-back right here, and that's where we want to have the top of that wedge right there. These are firm, so they're designed to be firm to actually help lift that thoracic spine, and then you're kind of resting there on your cervical roll. Now, to help take the edge off, if this is a little bit too firm for you, you could put a kind of a towel or a softer piece of foam over the top of those wedges to kind of create a little bit less lift. You can also put something under your pelvis to lift the pelvis up just a tad, like a folded over towel, to create a little bit less of a lift, to help reduce the pressure as you're kind of easing into this. Again, this is a position that you would not sleep on. This is a 20-minute position. However, your doctor will prescribe the appropriate time for you. Some people can go longer, some people are shorter. But it's a very powerful thing to help reduce this posterior T12 shifting and help lift this up, to help reduce that subluxation pattern that we so commonly see in our clinics.